This is Dr. Mercola. I want to welcome you to another question and answer video update. Today's question comes from a Teo in Vermont, and Teo has been afflicted with a toenail fungus for the last 60 years and wonders if there's anything natural he can do about it. Well, this is a particularly vexing problem that there really is no simple, easy solutions. I've treated many patients with this problem over the years, and there's clearly some therapies that do seem to work. Let me tell you first the traditional conventional medical model, which would typically allow for the use of a drug, typically a very powerful antifungal agent like Sporanox, which is given in a pulsed dose, typically over a week or two. For a strong dose, and then allowed to rest, which gives your liver an opportunity to recover and not causes severe damage. But typically it's done over 3 to 6 months because unfortunately the fungal infection in the nail can get quite thick and it becomes very resistant to any type of medical therapy. So that tends to work and actually will be very effective for many people. And unfortunately, though, unless you have insurance coverage, that treatment can cost many thousands of dollars because the medication is not inexpensive, and then there's blood tests that need to be done to monitor the liver function during that treatment phase. So the less expensive and certainly less toxic approaches would be to first identify the thickness of the nail, because when you have a fungal infection in the toenail, many people have this and don't know, but if you have a thick nail, there's a good chance that it actually is infected with a fungus. So you're going to want to use something like a Dremel tool or some type of surgical debridement where you actually decrease the thickness of the nail so that it's more open to any type of topical therapy that you would apply. So that would be one step, and this typically can be done pretty carefully if you do it yourself even. So that's a straightforward approach. But then you can apply a variety of different topical agents like tea tree oil or neem oil, a variety of other different therapies. Now, it's going to be also very important to address the sugar issue. So a fungus is, of course, a yeast and a type of yeast infection, and if a person is consuming too many sugars or processed foods, it's more likely that they'll encounter an overgrowth of these fungal types of organisms, and that can clearly infect the toe. Now, one approach, though, and I think one side effect of our culture where we're wearing shoes and socks, almost all of us all the time, is that it creates this environment where they're more likely to grow. So an ideal option is to live into a tropical or subtropical type of environment where you aren't wearing socks, and in fact for the most time maybe you aren't even wearing shoes, and you're actually connecting with the earth. With your foot on the earth is actually a good way of grounding yourself and actually providing a lot of other benefits. But clearly when your feet are not encased in shoes and socks, it's definitely a good thing. And another beneficial thing is to actually spend some time in salt water, actually the ocean, which is a supersaturated form of salt water, and can actually provide a antibiotic or antifungal type of benefit. And actually I've personally noticed that that is a very effective therapy. So just not wearing shoes and socks and spending some regular time in the ocean, maybe a half hour to an hour nearly every day if possible, and that by itself would likely be able to eliminate the toenail fungus. But of course many of us won't have the opportunity to do that. So as a reward for writing in the question for Teo, I'm going to give you a copy of my newest book, Sweet Deception, and there's a lot of great information in there about what you can do to avoid sugars and to really reveal some of the hidden mysteries and the deception, the fraud that's associated with the newest artificial sweetener, Splenda. So hopefully you enjoy that, and hopefully this information was helpful about this common topic that affects so many of us.